As President-elect Biden takes office, one of the biggest challenges facing his incoming administration, of course, is this pandemic. And he's planning a big vaccine push in the coming days. So with us now is Dr. Celine Gounder. She's a clinical assistant professor of medicine and infectious diseases at NYU School of Medicine and Bellevue Hospital. She is also a member of President-elect Biden's COVID-19 Advisory Board. Thank you so much for joining us. We have learned a lot about the President-elect's plans moving forward. Yesterday, we surpassed 400,000 recorded COVID-19 deaths. We have heard from some experts in the field that what we are seeing now is a result of the holiday break, that we haven't seen the last of the fallout from that. What is your expectation in terms of the death rate? Is it going to continue to rise in the coming weeks?
Anne-Marie, unfortunately, we probably are looking at 4,000 deaths or somewhere around there per day from coronavirus in this country for the next several weeks. And, unless we really do double down on the things that we've been advocating for months now, the masking, the social distancing, spending as much time outdoors versus indoors when you're around other people, or indoors in very well-ventilated spaces, sticking as much as possible to your household bubbles. If we don't double down on those things, we probably will continue to see these very high rates of death. We simply cannot roll out the vaccines fast enough to prevent that death toll today.
The Washington Post is reporting this morning that President-elect Biden will be asking Surgeon General Jerome Adams to resign. What's the significance of this move? He was actually one of the few members of the administration that was very vocal about people, wearing their masks, washing their hands, and particularly encouraging members of the African-American community to make sure they get those vaccinations.
This is pretty standard. When you have an incoming president, he's going to want to have his people he's worked with for years, who are loyal to him. Dr. Vivek Murthy served as Surgeon General under President Obama and Vice President Biden. He has a very long relationship with this team. I don't think this is surprising. I wouldn't read too much into this being a criticism of the current Surgeon General.
Okay. Of course, the big announcement from the president-elect in terms of his plan to combat COVID-19 is that he wants to see 100 million doses of the vaccine delivered in 100 days. It seems like an ambitious endeavor, particularly considering we're hearing from some states now who say they are running out of the vaccine, that they'll run out by the end of the week. Is this doable? What does the federal government need to do in order to make this happen?
Look, this is an ambitious goal, but we believe it's doable based on our conversations with the pharmaceutical companies, the manufacturers of these vaccines. The number of doses available should be ramping up over the coming weeks to months, where that really does loosen up that bottleneck. So the key things we need to be doing now are increasing the number of sites where people can get vaccinated, the different ways in which they can get vaccinated. And so that includes working with local pharmacies, your corner drugstore where you might pick up your prescriptions. That includes mass vaccination sites. And that's not just the Dodger stadiums and Fenway parks, but that's also in communities, especially the hardest hit, most vulnerable communities. We'll be working with primary care providers and federally qualified health centers that very much serve some of those most vulnerable communities. So it's really about trying to find different ways of getting the vaccine out to as many people as possible.
So clearly that's one of the challenges with the vaccine rollout, and you're addressing it. Getting the vaccine to where people are, whether it's a big site or a smaller location like a pharmacy. What are some of the other hurdles, do you think, that have been making this vaccine rollout so bumpy?
I think big picture, and this is not just with respect to vaccine rollout, unfortunately, the pandemic has been politicized in a way that has been very damaging to the American people and to efforts to control this pandemic. So I think you're going to see the tone change. You're going to see the president-elect really call on Americans to do their part to pitch in as we're working to get 100 shots in arms in 100 days. He'll be calling on Americans to mask up for 100 days. That is the part that they can do to help us control the virus here.
Yeah, I think that is one of sort of the biggest challenges, is to convince people that when the vaccine is available, they should go get it. Hopefully we'll be able to continue this conversation in the coming days. Dr. Celine Gounder, thank you very much.